how many patients do you have that are there just for THC addiction compared to the other ones?
Yeah,
Since we're talking about a dispensary, that's going to be like the issue.
Sure.
How many of those are just patients dealing with that issue?
Yeah, so we keep an eye on that in terms of our patient load. What I'll tell you is I don't have an exact number. What I can tell you in terms of percentages, we haven't seen a significant increase with that just because we treat the patients holistically. So what I mean by that is whatever's driving them to be in our office at the time of the assessment, that's what we're treating. And so it sort of depends, again, on the patient and why they're there. But
I would say that, marijuana use disorders are typically a part of multiple substance uses. It's generally not been the primary driving.
Oh, I agree wholeheartedly with that
I
one.
have to say that it often is the one that is most challenging throughout the progression. And,
Can you expand on that, please? You says THC is the more challenging addiction?
Well, in terms of, we often see that as a lot of relapse around that. It's often a factor around the medicated assisted treatment. Opiate use is often tied. They see that as a substance that's very challenging for those working off of opiates around marijuana.
I thought you said THC was harder than opiates.
No,
I was going to say.
The challenge in that regard would probably be more significant in, to your point, the opiates and cocaine or benzos even, benzodiazepines, whereas folks maybe THC is seen as more of a common drug, if you will, now legalized. Is it really? You're hearing lots of different information from even from what the mayor opened up with in terms of the bill, but I think that's probably the more significant challenge is that the issue, or is it further down the road? Is there other things that are causing complications, and that's just one piece.
My name's Rick Smith. I'm from Full Circle. Like many of us have already said, we meet our clients where they're at. And with that, we've got 36 beds currently with Fairborn. They're all male. We do have a lot of partners, so we're able to provide the transportation, the case management needs. We're able to assist with court liaison situations. So a lot of it's overlapping. And I'm ready for your question.
Oh, goodness. Oh, goodness.
Again, I like going towards the end because I was able to prepare for that one.
You want me to ask you? Okay,
no,
give me a second. I'll think of one.
me
No. Okay, I'll follow up with kind of like I did them. How many cases do you see that are strictly THC? And then how many do you see that are alcohol or anything of that nature?
I don't really follow the actual case studies and numbers. However, when it comes to alcohol, when it comes to marijuana, and we've all heard the phrase that it's the gateway drug, right? Yeah, a couple of head nods. It can be. Much like alcohol, many people can have that and consume it without having a reaction.
True.
Well, for whatever reason, if an individual has experienced or experimented with marijuana during their process, when they've continued on and tried something a little harsher, all of a sudden that process, anytime they enter into that process at any point, that is their gateway. I was in Dayton for probably 5 or 6 years, and it's not necessarily any resource that causes it. It's actually the resources that help give the foundation to help people out of that situation, like Green Met or any of the housing authorities.
Okay, thank you.
Sure.
Do you want to make a comment?
I was just saying, absolutely, that was not what led to the opioid
Okay.
crisis in Fairborn.
I've kind of heard that, and I saw some of the data that kind of goes with it, but I'm not solid on it, so I'm still open to listen and
Yeah,
hear what the community has to say. And they would be the expert. You guys would see the numbers. You would know.
Yeah, I
Just-
lost about.
Especially you guys with 35 years.
I would just say, we've been in town. Matter of fact, Mayor Kirkpatrick, when we were thinking about maybe he was adamant in us staying involved in the community, and we appreciate that. No, to your point, that's a support for folks that are struggling, that need to be picked up, and having that resource is invaluable. Without that resource, just like vocational type of resources or things like that, those folks can't take the next steps and be effective. Imagine trying to, kick a drug addiction and being homeless and trying to do that, or not having a safe place to stay. And to that end, I think the mayor's aware of this. We have a 40-bed unit that we're bringing to the area. We're going to break ground. We're firm on this now. We're going to break ground in March here, so next month, and it'll be a 40 unit for SPMI and homeless and folks that have a lot of the comorbidity and the challenges that we're all talking about here tonight. I would say without those resources, though, it would make it even more difficult, not add to the problem. So,
Right. And to that point, I would add, also, what you might be seeing is a correlation between poverty and addiction, which definitely there is
Oh, yeah.
comorbidity between poverty and addiction, so.
And the reason I bring up that, they haven't paid out a check since August. I talked to them the other day. They haven't paid out a check since last August, so that resource isn't there.
Who pre-met?
Yeah. I was trying to help an elderly couple find a place the other day, and they were past August and still had a long line of people ahead of them.
Yeah.
So no one's getting that resource.
Correct.
So it is a great resource, but no, Green Met is not helping anybody right now.
Right,
I
but
have
I mean,
relatives receiving it.
Well, if you're already on it, you're good. But if you're signed up to get it, you will not get it. Like I said, they're back all the way to August if you're not already on it.
I
So
have
if
a tendency.
Marijuana's been used in this country for years.
sure.
And it's been, for some people, no problem at all. For some people, it has been a horrible problem. I remember working, when I got out of nursing school 50 years ago, that one of the guys I worked with, I worked in San Bernardino, California, on their acute care psychiatric unit at the county hospital. We were the only acute care unit in the entire county of San Bernardino. And if you know anything about San Bernardino, California, geographically, it is the largest county in the 48 lower states. It's a huge county. We were the only acute care unit. We saw a lot of substance abuse coming through our facility. That was back when angel dust was very predominant, heroin, meth, and a lot of marijuana. So I'm used to seeing that, and I'm not trying to raise a red flag that we're suddenly going to have everybody in Fairborn with marijuana problems. Not saying that at all. The idea with tonight is, for those of you that have concerns about Fairborn getting a dispensary, we want you to know that there are treatment programs in town. And there are some very good treatment programs in town. So if somebody you're working with, or if you're having problems, whether it's marijuana or whatever, we've got programs in town to help you with that. And that's why we're here.